Good afternoon, everyone, and welcome to the first news conference from the Unified Command for Maricopa County. I'm Fields Mosley. I'm the Communications Director here at Maricopa County. The Unified Command you're going to hear a lot about today. It combines the efforts and the forces and the personnel from Maricopa County Public Health as well as Maricopa County Emergency Management and any other department that eventually comes into this fold that needs to operate out of this command. You'll be hearing from a number of people today, including the chairman of the Board of Supervisors, Clint Hickman. You'll also hear from the Emergency Management Director, Robert Rowley, the Public Health Director, Marcy Flanagan, and Dr. Rebecca Sonnenschein, who is our Medical Health Director at Maricopa County Public Health. We're going to be taking some questions a little bit later on from our reporters that are joining us via the webinar. I ask you to limit your questions to 2 questions. We'll be doing this, though, through the audio feature. So you'll hear a moderator come in and say, okay, your microphone is open now. Please go ahead with your questions. Ask us both questions at the same time, please. Again, please limit it to 2 so we can make sure we get through everybody who has questions today. And we'll try to do our best to answer everything that you have. If we don't have that expertise or that information in the room, we will take a note of that and get back to you. So with that, I'd like to introduce you to Chairman of the Board of Supervisors, Mr. Clint Hickman from District 4.
Good afternoon, everyone. Today we are moving to a new structure, a unified command, all under one roof because we know Maricopa County is at a crucial stage of this pandemic. My fellow board members and I have been receiving daily updates for 4 weeks now. We have confidence in our team at Public Health and Emergency Management and how they are using their expertise and relationships with the state to respond. There are many issues associated with this crisis that we can talk about. Today, let's focus on personal protective equipment. This is a big issue for our staff and all healthcare providers. We are not just monitoring the situation, we have been reaching out to vendors to purchase more so we can distribute to healthcare providers and long-term care facilities. The board knows this is serious, and we will provide resources in areas like this where we have the expertise and the responsibility to help. I want to thank everyone at the Unified Command for their hard work. And the public for taking such extreme measures to protect each other. Stay home, stay healthy, stay connected. Maricopa County will continue to support the state of Arizona as we fight COVID-19 together. Now let's go to the subject matter experts. Let me introduce Robert Rowley, Director of Emergency Management. Robert.
Good afternoon. As it was stated, as of 8 o'clock this morning, Maricopa County Department of Emergency Management and Maricopa County Department of Public Health entered into a unified command. Some people might want to know what that means. The unified command is a unified command structure where 2 or more agencies enter into and form a single organizational structure to operate under. This provides many efficiencies in an emergency management and emergency response scenario. Some of those efficiencies include a greater degree of communication between multiple agencies, the ability to develop a collective approach to objectives and strategies on how we are going to respond, and as well as significantly increasing the overall situational awareness we have across the county. One of the other advantages to this is going to be responding to the situation with the personal protective equipment, or PPE, which has turned into quite a logistical challenge. And with that, we will be able to form a joint logistics operation, which we also have working at the Unified Command, which both public health and emergency management personnel are working at right now in an effort to streamline that process. And it is a complicated process, and with that, I would like to turn that over to Public Health Director Marcy Flanagan to discuss it more.
Good afternoon. So when we say personal protective equipment, what we're referring to are surgical masks and gowns and gloves, N95 masks and face shields, and any other equipment that is needed to protect our healthcare or others from exposure. PPE is most important for our healthcare and those who are caring for individuals that are sick or vulnerable. Keeping healthcare quality PPE with healthcare partners is vital. It keeps them from spreading the virus to other individuals, and it preserves our healthcare workforce so that they can continue to provide the great care that we are used to receiving in this country. Our PPE shortage is not a funding problem. It is a national problem in the supply chain. This is an issue for the disruption of everyone that needs PPE, and it's difficult to get orders filled. This has become such an issue that the federal government released the cache of the Strategic National Stockpile. To date, Arizona has received 75% of its allocation of the Strategic National Stockpile. Maricopa County, we have received 100% of our allocation of that stock. We are doing our best to be responsive to the needs of the community and to be transparent in the policy decisions of how we are distributing the SNS. On April 1st, Maricopa County received its final allocation of PPE from the federal national stockpile. Although helpful, these allocations are nowhere close to the need of a community our size. To put this into perspective, our healthcare and hospital systems use about 544,000 surgical masks per week. For our entire allocation, we received 263,000 surgical masks. As you can see and hear, this amount will not support our hospitals for even a week. So we had to determine who we were going to give this PPE to in a strategic way that meant the most benefit for our entire community. And with that, I'm going to turn it over to Dr. Rebecca Sonnenschein, who will speak to how we allocated our PPE.
Good afternoon. I want to explain now why we are prioritizing our personal protective equipment for our long-term care facilities. Skilled nursing facilities, nursing homes, assisted living, and hospice are all considered long-term care facilities. And there are more than 500 of these types of facilities in Maricopa County. To date, we have identified 66 cases of COVID-19 and 10 deaths that have been linked to 22 long-term care facilities. These numbers are constantly changing, and because we know our community is very concerned about our older adults and those who are at the highest risk of severe complications of COVID-19, starting tomorrow, we're going to be releasing specific numbers about the number of cases and the number of deaths that are related to long-term care facilities. We will not be releasing facility-specific data in order to preserve the confidentiality of our loved ones who are living in those facilities. If families have loved ones who are living in long-term care facilities, they can reach out to that facility directly to understand what types of measures they are taking to protect their own loved ones. What we know from states like Washington is that when you get one single case of COVID-19 in a long-term care facility, you tend to see rapid spread. And we know this because they are living in a communal setting where they have shared meals and shared activities. You also see higher levels of severe disease because the people who tend to live in long-term care facilities tend to be older with more underlying health conditions, leaving them the most vulnerable to this situation. Before we ever identified cases in long-term care facilities, per the governor's executive order, we reached out to all long-term care facilities and gave them ways to keep COVID-19 out of their facility. Things like reducing any unnecessary visitors, any unnecessary health care, and making sure to maximize social distancing as much as possible. Once we identify a case in a facility, we individually contact that long-term care facility and work with them step by step to introduce more strategies that will help keep the disease from spreading among their residents. And that includes a series of infection control recommendations that keep not only residents from spreading it to each other, but also healthcare workers from spreading it to residents. And this includes having residents stay mainly in their rooms, including for meals, and canceling all group activities, as well as putting every single resident in isolation precautions who has symptoms. Recently, CDC has recommended that every single resident be put in isolation precautions, and that is the best strategy to keep disease from spreading in the facility. What that means is that every healthcare worker and meal server and every staff person who walks into a resident's room has to wear gowns, gloves, a mask, and an eye shield each time they interact with a resident. That's been shown to be the best way to protect our loved ones from getting disease in a long-term care setting. And that's what we learned from Washington, that's what's necessary to keep these outbreaks contained. The only way that long-term care facilities can follow these practices is if we provide them with the personal protective equipment that they need to make it happen. This is why we have made the decision to prioritize our limited supply of PPE to long-term care settings. We believe that the limited number of masks and gowns and gloves will have the biggest impact in long-term care facilities, where it will protect the lives of our loved ones who are at the highest risk of severe disease, and it will also keep them out of the hospital and reduce stress on the healthcare system. In addition, we've been working closely with the Arizona Department of Health Services, emergency medical services, our hospital systems, and the Maricopa County Board of Supervisors to monitor personal protective equipment supply and identify any new venues or alternative venues for purchasing PPE. As we are able to purchase more PPE, we will continue to ensure that those caring for our most sick will receive the PPE that they need. Thank you, and we'll take questions.
So now we will open up to questions. As I said at the beginning of this, there's a little bit of a delay with the webinar functionality, but Chad Amos will be conducting that, and we should be able to hear the questions in here. So virtually, if you're a reporter and you're on this right now as an attendee, we invite you to virtually raise your hand, and then we will call on you shortly.
I have a question from Nicole Craig. Your microphone is now live, Nicole.
Thanks for taking questions.
Sure.
I guess on my first question is counties, hospitals, providers, they have been told to prioritize testing. So my question is, do we need more testing for true projections and what is happening here in Arizona? And are Arizona's numbers giving us an accurate idea on what's happening?
Dr. Sunshine?
Thank you for that question. I think there's a lot of misconceptions about the importance of testing for public health. While testing is a very valuable resource for public health to have situational awareness, there are a lot of ways that we know what's happening in our community with COVID-19. So every number that you see typically represents those who are the most severely ill, those who are hospitalized, and just some of those who have milder disease. We also know that anybody who doesn't have any symptoms at all, but still has the disease, is very unlikely to get tested. So not just for COVID-19, but for any disease, you know that the numbers we're seeing underrepresent how many cases are actually out there. And that's why public health relies on a lot of other tried and true ways to monitor how much disease is in the community. Those are things like measuring the emergency room visits for influenza-like illness, which we know now that flu is gone, typically represents COVID-19. We closely follow the number of people hospitalized, which we know tends to be a lot more accurate. So we have plenty of other ways to monitor situational awareness, know where we are on that curve, and make appropriate recommendations for strategies when we see things change.
Okay, thank you very much, Nicole, for that, for those questions, and thank you, Dr. Sonnenschein. Do we have another reporter with questions right now?
Yes, our next question is from Peter Samori from KTAR.
Peter Seymour.
Good afternoon. I hope you can hear me.
Yes, we can hear you, Peter.
My question is, what does the chain of command look like for this unified command center, and how is information shared?
That's a good question. we do have a very clear chain of command, but it's a shared chain of command. And that's something that makes it very unique to what we call a unified command. It essentially means we have somebody at every stage in that chain of command from both public health and emergency management sitting next to each other, at least sitting next to each other at the proper spacing. And when decisions need to be made anywhere along that chain of command, it's made collaboratively between the two disciplines.
Okay, Peter, I hope that answered your question. And do we have another question from reporters that are online right now?
Yes, we have a next question from Craig Harris. Craig, your microphone is on.
Thank you very much for taking my question. A couple questions on the numbers. Could you go over when you say Arizona has 75% of its allocations from the strategic stockpile and Maricopa County has 100%? What do those percentages mean? And could you also specifically talk about respirators and what you're doing to get respirators out to hospitals or care facilities? Thank you very much.
Okay, thank you for the question. I believe Marcy Flanagan, the Director of Public Health, will take that question.
Hi, so when I talk about the percentage of the SNS, so Arizona as a whole received, every state has a specified amount of the strategic national stockpile. Arizona received 75% of its allocation from that strategic national stockpile. That is then divided among all 15 counties in Arizona by population size. And so when that arrived at ADHS, Maricopa County, along with all the other 15 counties, we have all received 100% of our allocation from that 75%. And in 95 Mass, we are still prioritizing to acute care hospitals. We are trying to procure more PPE through different channels, and we are still encouraging all the hospitals that can continue to purchase PPE to still do so.
And I know, getting back to the numbers part of that question, I know the governor has released very specific numbers of what we got out of the, at least the initial allotment from the SNS. So if you need very specific numbers on that, I invite you to send us an email to the Joint Information Center here, and we'll work on getting those answers for you. The email was on the press advisory this morning. It'll also be on future press releases that go out later this afternoon. So it's caomedia@maricopa.gov, caomedia@maricopa.gov. For the moment, though, let's go to another question.
Brian Webb has a question. Brian, your microphone is live.
Hi, thank you for taking my questions. A couple of them, if you don't mind. Some new models from Washington State University put our state's peak cases coming in at April 11th and peak deaths at April 18th. Can you tell me if that matches what your projections might be for the county? And secondly, lastly, do you have any numbers on the people who have recovered or are recovering so far?
All right, thank you, Brian. I'll turn that over to Dr. Sonnenschein.
I'm glad you asked about the models that have been put out there. There are several different models, and I have taken a look at the University of Washington one as well as several others. And what's really important about models is to know that you have to enter what's called assumptions into these models. And each assumption is an educated guess about how many people might die from this illness, about how quickly the illness spreads, and even some things about the population that we know. Some of them are factual information, and some of them are truly just what we think might happen. So when you adjust each of these assumptions, it changes when we will see the peak of COVID-19 and the peak of deaths that you asked about. And what you'll see is if you follow along with these models, they change over time. And that's because as we learn more information about the spread of the disease, the picture of what we think we're going to see changes. So to answer your question, does that particular model match what we think is going to happen? We think that is one possibility, but we don't truly know the exact mortality rate of COVID-19 in the United States. We know that it's likely to be different than a country that may have less resources than we do. And we also know that the more we implement social distancing and the more we increase our healthcare capacity, the less mortality or deaths we are likely to see. So I would caution relying on any one single model, and I would look very closely at the assumptions that are in those models, understand how, if they change, they might affect things, and know that we are all anticipating that the peak will be forthcoming sometime in the next 2 to 4 weeks, but we really don't know when that will be.
Okay, Brian, I hope we got both questions answered there. Do we have another question?
We have a follow-up question from Peter Seymour. Peter, you'll have.
Peter Seymour.
Thank you. As a follow-up, who are the members, departments or individuals of the Unified Command, and what other decisions are they making besides for PPE?
I'll let Robert Rowley, the Director of Emergency Management, take that.
Thank you. So far, the main members of the Unified Command are Department of Public Health and Emergency Management. We also have the Maricopa County Sheriff's Office in there with us. We have some liaisons from the state. And tomorrow, we're going to have individuals from the Human Services Department, the American Red Cross, and the community organizations active in disaster. And those are non-governmental organizations that play a disaster emergency response role. We will add and remove departments and agencies to the Unified Command based on when there's a necessity for them to participate in the response and when maybe their part of the response phases out. Oh, that was another part of your question, was what sort of decisions are we making in the Unified Command other than for PPE? A lot of them have to do with the situational awareness and gathering intelligence on the situation and trying to find out exactly what the effects are across the county. You can imagine on a county of this size with all the different cities and towns and tribal entities that gathering that information from all of those disparate sources can be quite a task. So that is one of the things we're working on. Besides the logistics effort, a lot of communications between the different departments and different jurisdictions, relaying our situation up to the state. So we also have another very specific list of objectives that we go through every day. It's kind of too extensive to go through all of those right now. One of the things that's on those objectives that we're working on is what we're doing right now, which is trying to get information out to the public on what's happening and how the county is responding.
All right, thank you, Robert. Another reason that Joint Information Center is now located very close to these other two entities, the Emergency Operations Center and Unified Command. So we can be in more contact. We've been having lots of conference calls, but now we can see each other face-to-face as needed as well. Do we have another question from a reporter?
We have a follow-up question from Nicole Grigg. Nicole, your microphone is live.
Cool.
Yeah, I think you guys cut out before. Did you guys indicate how many people in Maricopa County are in long-term care? And my second question, since I didn't ask it before, is it possible that deaths are being underreported? If we know people can't get tested, are people also dying that we don't know?
So how many people are in long-term care, not just the number of facilities is what you're looking for, and perhaps deaths are being underreported. Dr. Sonnenschein will take that question.
So, although we have more than 500 long-term care facilities, there are so many facilities that are both large and that have different levels of care. And there are also a lot of home facilities where just 6 or 8 people are getting care in one place. So it's very difficult to say what proportion of the population are in long-term care facilities, but we do know that those who are living in communal settings with underlying health conditions are at the highest risk. I'll talk a little bit about what we're doing to identify people who have died from COVID-19. Maricopa County Public Health is working very closely with the medical examiner, And we're relying heavily on our healthcare partners to do testing of people who are severely ill, and we know that they all meet those testing criteria. And because they're being prioritized for testing, we believe that people who die in a healthcare facility are being tested and that we're capturing all of those. Individuals who die at home, a proportion of them fall under the jurisdiction of the Office of the Medical Examiner. And when that's the case, we've worked to develop a system where if they meet screening criteria, which are basically if they had respiratory symptoms of unknown source when they passed away, or if their family had respiratory illness circulating in the household, we are then testing them after death. And then for those who do not go to the Office of the Medical Examiner, we're screening them as well, and we're coming up with a way to estimate among those individuals whether they died from an illness similar to COVID-19. And that's how we are estimating the deaths here in Maricopa County.
Thank you, Dr. Sunshine. Thank you, Nicole, for that question. Do we have another question from another reporter?
I have a question, follow-up from Craig Harris. Craig, you're live.
Craig, go ahead.
Hi again. I asked this earlier, but I don't think it got answered, or maybe I didn't hear it. Could you talk about respirators? How many respirators does the county have, or is that at the state level? And can you give me a ballpark about what is the cost of one respirator?
I'm not sure we have a cost estimate on a respirator, but do we have a number count on the number of respirators we have in the county?
May I ask for a clarification? When you say respirator, do you mean a mechanical ventilator to help someone breathe, or do you mean the mask?
I mean a ventilator. Thanks for clarifying that. I'm looking for a ventilator of what some of the issues that have gone on as of Oregon and Washington have donated some of their ventilators to New York State. So that was my question. Sorry for not being clear. Thank you, Doctor.
That's okay. So what I can talk about our we've estimated the total number of ventilators that currently exist in the state, and the Arizona Department of Health Services is working in the State Emergency Operations Center closely with the governor to procure additional ventilators to make up for any capacity that we believe we do not currently have. So I know that they have placed an order for enough ventilators to make up between what we have right now and what we need. We also know that other states have utilized ventilators from other sources, for instance, pediatric hospitals. We know that children tend to not have severe illness with COVID-19, so that's another source. So at this point, we do believe that we will have an adequate supply of ventilators to the best of my knowledge.
So I was just informed a lot of you are out there and you're typing in the chat portion of this webinar to get us to answer the questions. This is really set up today to take your questions verbally. So please raise your hands virtually in the webinar and then ask your questions as you're called upon by Chad. So Chad, do we have anybody else in the queue right now?
Yes, we have a question from Brian Webb. His microphone is self-muted, so I can't unmute him if he'll unmute himself.
So Brian, if you can unmute your microphone and trust that you're...
I think I got it.
Okay, there you go.
Hear me?
Yeah.
Okay, thank you. Checking, are you keeping track of people who are recovering or who have recovered? And also, this may be a dumb question, but can the virus live after the host's body is dead, and for how long? And are people who are inspecting them taking precautions so that it doesn't spread to them?
So we're talking about recovery rates, and then we're also talking about active virus staying and postmortem and PPE, I suppose, for our emergency responders that are dealing with that. And also our Office of Medical Examiner. So Dr. Sonnenschein, you field that one? Or those two, please?
Okay. I'll start with the second question first. Okay. We do not have adequate studies to know how long the virus might survive in someone who has passed away. For that, we are treating this like other infectious diseases that are possibly infectious after someone dies, and CDC and Arizona Department of Health Services have put out guidelines for staff in mortuary services, as well as medical examiners, to protect themselves with personal protective equipment while they're handling these bodies to make sure that there's no exposure to COVID-19. And that is one of the reasons why we are taking a small proportion of the Strategic National Stockpile of personal protective equipment and supplying it to the Office of the Medical Examiner so that they can continue to maintain their workforce.
Recovery rates.
Recovery rates. We have gotten that question. We're able to keep track of the total number of people who are diagnosed with the disease, and we also closely monitor those who have died from the disease. So the best we can do is assume that everyone who is who continues to not be included in the death count will recover. And based on what we've heard from other studies, that most people who do survive the illness tend to fully recover from the illness. But again, this is information that we're still learning. We're very early in this process, and there's a lot more to learn yet.
Thank you, Brian, for those questions. Thank you, Dr. Sonnenschein, again. Do we have another question?
Yes, we have a question from Leon Gonzalez.
Okay, go ahead.
Leon, your microphone's live. Looks like he's dropped out of the
Okay.
conference.
Do we have anybody else?
No other hands raised.
Okay. Last chance here. Any other hands raised in the webinar? If you've put in a written question, what we'll try to do after this is we'll go through those written questions and we'll send you an email with an answer to those questions. But for future notice, we are going to be conducting these as is with the verbal questions coming in. This is easier for us to respond this way. So please work with us on that and join us with a microphone from your computer. It's pretty easy for us to hear in here and respond accordingly. Chad, anybody else at this point?
We have one more follow-up from Nicole Grigg.
Okay, go ahead, Nicole.
I was just going to follow up on these long-term care facilities. You said 66 positive cases. How many facilities is that with 66 cases? Are we talking 2 or 3? And also, why will you not say where the outbreaks are?
So you're talking about more localized information. I believe Marcy covered that number early on. It was 22 different long-term care facilities was covered early on. And I know we provided this explanation many times whenever it comes to why won't we do this by zip code, why won't we do this by city. As Dr. Sonnenschein has alluded to many times during this press conference and other opportunities, that it gives you either a false sense of security or a false sense of fear, because we don't have great tracking. Obviously, we know this, and you've heard a lot about that today, why the estimates and the models are just that, people trying to predict the future and give an educated guess as to what's going to happen. This is not the way public health is going to track this within our community. We know we have community-wide spread, and that means that everybody should assume they can come into contact with this virus at any time. So I hope that answers your question. Do we have any other questions?
There are no questions currently.
Okay, well with that, that's going to end our first webinar and press conference, and we appreciate all the reporters who joined us today. Again, we'll try to get to those written questions, but please, for future reference when we send out these advisories, please go ahead and plan on asking your questions verbally so we can answer them directly and not have as much follow-up and you're not waiting so long on us. So with that, thank you so much for being here. We will have another webinar in the near future. Thank you.